Good day. I'm Dr. Bryden Grant, and I'm here to welcome you to the CPAP clinic. I'd like to start off by explaining why you are here. Your primary care provider suspected that you had sleep apnea. So in this facility, we allow primary care providers to send patients directly to the sleep lab for a diagnostic study. You were referred to the CPAP clinic because he was right, and we need to determine the correct pressure for your treatment. If you were to be seen in a facility outside the VA, in the private world, your primary care physician who suspected you had sleep apnea would have to send you to see a sleep physician. The sleep physician would then send you to a sleep study for a diagnostic study. Then you would go back to see the sleep physician, who would then send you to the sleep lab for a therapeutic sleep study. And you would then be referred to the CPAP clinic for treatment. Why didn't you see a sleep physician? Well, our primary care providers are about as accurate as sleep specialists at predicting sleep apnea, so we allow them to refer you directly to the sleep clinic. Although VA sleep physicians do not see you, we do read the sleep studies performed here at the VA and the long questionnaire that you completed to draw attention to any possible problems. We use an auto-titrating CPAP device to avoid the need for an in-lab therapeutic study. This approach is used because it avoids delays in getting you started on treatment. Why is the private world different from the VA? Well, outside, the third-party payers pay for clinic visits and tests only. They do not reimburse the extra amount needed for using these automated CPAP devices. And they do not reimburse for analyzing the results of auto-titration CPAP. Providers at the VA are salaried and not fee-for-service, so we can choose the best pathway for you without considering reimbursement issues. You might ask, why CPAP? Why not other forms of treatment? CPAP is the first line of treatment for sleep apnea. Surgery used to be used, but it is about half as good and works in only half the time. Surgery cannot be undone, so surgeons want to know if CPAP has been tried before embarking on the procedure. Obesity can aggravate sleep apnea, but it is often not the sole cause. A 10% decrease in body weight reduces the chances of needing CPAP by 15%. It takes time to do that, so you would need CPAP in the meantime. Avoidance of alcohol can reduce severity of sleep apnea, but it is rarely the sole cause. Avoidance of sleeping on your back in the supine position can eliminate sleep apnea when it is mild, but there are no long-term studies to determine its effectiveness over the long haul. Clinical trials have shown that oral appliances can be useful, but you need multiple visits to a dentist specialized in sleep medicine over several weeks, and then another sleep study to see if it works. At present, oral appliances do not allow for long-term monitoring of the use and effectiveness of this treatment. You might be asking yourselves now, why is CPAP for the long term? Well, there is no cure for sleep apnea at present, except in rare circumstances we've mentioned. Studies in both Europe and the United States have shown that the more patients with sleep apnea use CPAP, the less likely they are to develop conditions associated with sleep apnea, such as high blood pressure, coronary artery disease, and stroke. Now, CPAP will not eliminate those conditions in your future. What CPAP does is reduce the chances of them developing in you. Why don't I see the sleep physician in the CPAP clinic? Well, CPAP was in fact developed by a physician, a friend of mine in Sydney, Australia. He used his mother's vacuum cleaner to raise the pressure and found that it worked. But his mother wanted a vacuum cleaner back, so he had to go to a commercial company to get it made. Over the years, these devices have become more complicated due to multiple improvements. You might ask, what happens if my sleep problems do not improve with CPAP? Then the respiratory therapist will refer you to the sleep disorders clinic to see a sleep physician, either Dr. Charia or myself, Dr. Grant, if there is a problem that the respiratory therapist cannot resolve. My supplies and appointments, you might ask yourself. Well, you're going to be given a list of telephone numbers to call. The advantages of this approach are you have a chance of talking to a human. The disadvantage is that you may only get to talk through an answering service, and messages sometimes get lost. But there is another way. You also have access to us through My Healthy Vet system, which we are proud of because it is only the VA has such a system. The advantages of this system are that, first, it is confidential but monitored to make sure someone answers your questions. Second, if that person is on leave, the message is diverted to someone else. And third, you also have access to reports in your medical record. The disadvantage is that you don't get to talk to a human. The good news is that you have a choice. Use the approach that best suits you to solve the problem that you have. Well, I'd like to wish you good luck with your new treatment. About half the patients have problems adapting to sleep apnea, but the other half have no problem at all. If you have problems, please bear with us while we sort out a solution for you. If you have any questions, please do not hesitate to contact us by whatever method you choose. Thank you for your attention.